Welcome to this episode. You're about to meet a man who's using technology to take healthcare to the remotest parts of India. He is Sujay Santra from Kolkata. India has a doctor each for over 1,000 people. Most of these doctors are concentrated in urban and semi-urban regions, while 60% of the population lives in rural regions. The lack of infrastructure and vast distances often prevent doctors from reaching the furthest parts of the country and patients from accessing care in time. Sujay Santra and his team at iCure are changing this through technology and mobile clinics. Sujay, tell me, what is the biggest problem when it comes to access to quality healthcare in rural India?
In India, we have more than 1.2 billion population, and out of that, 70% of the Indians stay in villages, which is being catered by less than 30% of the doctors. So as you can see, the demand and the supply gap is humongous. During any medical need, patients have to walk many miles. And the irony of the fact is that the rural residents in India end up paying much more than their urban counterparts for any kind of medical need.
So why is it that rural Indians have to pay more for healthcare than urban Indians?
Even for a primary healthcare need, patients have to walk many miles, and in that case, patients do not travel alone. They have to travel with their friends, relatives, so that adds to the total cost of cure. In many cases, the patients, they have to, lose out on their daily wages, and most of the travels are not planned. Like when they travel to the cities, the doctors are not available. They have to wait for the doctors, and so it all adds to the cost of the patients, especially in the rural India.
And how are you trying to address this at iCure?
In India, we have for every 1,600, 1,700 patients, we just have one, MBBS doctor. We cannot, create doctors overnight, or we cannot create hospitals overnight. But what we can do is to effectively, use technology to, multiply the availability of the doctors.
So tell me, how is it solving the problem? How does the technology platform work? And on ground, what are the benefits, to the consumers, to the people in rural India who need healthcare services?
I'll give you an example. We were working in one of the most remote districts in Bengal, West Bengal. It's called West Midnapur, and this place is called Salboni, which is jungle affected area. They had mobile clinics which was being operated like every once in 15 days. And we saw that few patients, they were hurriedly coming to that clinic, and the time was around 1:15, and they had been walking barefoot for 15 kilometers
to get to the clinic.
And by the time when they arrived, the doctor had left. So they had two options. Either they could have waited for another 15 days to see the doctor, or they had to walk another 20 kilometers to see the doctor. So then we came up with the idea called as, the health workers. So health workers are like mostly the female graduates, or they have a class 10th pass. And then we train on the medical basics, like how to take a BP, ECG or sugar. And we have developed this technology solution wherein these health workers, they are given either a laptop or a tablet which is loaded with our solution. And these health workers, act as the interface between the doctors and the patients.
And where are the doctors then?
In this particular scenario, the doctors are sitting in the urban settings, and it can also happen like this doctor, let's say this is a particular medical team comprising of the doctor, paramedic staff and the health worker. This health worker, is operational every day on that particular clinic. Let's say if a patient is walking to the health worker, the health worker, has a set of questions already. It works like a virtual doctor. If the patient is having a pain, a fever or any other things, automatically the corresponding questions related to pain or fever would be asked as if the doctor is asking. So then this entire, data is captured into that. And when the health worker goes to the clinic, this data is being synchronized, and then the doctors at the other end would be able to see this entire information. So it is like, remote monitoring, and our solution works up to the last mile, even there needs no internet or electricity. So using a simple disruptive technology solution, we are trying to address this problem.
iCure's health workers are from local communities. They understand the local culture and speak the local language. This greatly helps the team provide care amongst the remotest parts of rural India. iCure's technology helps doctors monitor patient health remotely, offer prescriptions, alter them, and recommend that patients go to the nearest town for specialized tests.
We are giving these health workers something as medic bags, and these medic bags comprises of some point of care devices like blood pressure instrument, ECG instrument, sugar testing equipment. Plus we are bringing, a lot of partners are now willing and has shown interest to partner with us to come up with some set of new point of care devices. Just to give you an example, like if somebody has to do an ECG, if there is a case of breathlessness, or there is some maybe a mild symptom of heart issue, that patient has to do an ECG. So right now, if the patient has to do an ECG, it has to maybe probably travel 50 kilometers.
Yeah, to the closest town at least.
Yeah. So in our case, this health worker has something called as portable ECG machine, and then the ECG is done at the patient's home, and then this signal is transmitted via mobile phone to a server, and the doctors at Mumbai or any other place would be able to send a ECG report and to our centers, and then this report can be handed to the patients. So technology is going to the patient's home up to the last mile, and we are enabling that.
That's fantastic. So you're not from a healthcare background, right? So how do you tie in the two worlds? So this technology on one hand, obviously you've done a fabulous job of enabling technology to deliver healthcare in the last mile. But understanding healthcare and understanding what's needed over there, the touch points required, that's a different ball game altogether. So how do you incorporate, that world with this?
When I was conceptualizing the whole idea, I was in fact talking to several doctors who are in my family, friends and all. And I was doing a lot of interactions with the professors in United States, UK and other places to try to understand the problems. And while doing so, like I was a solution architect in Oracle, designing some of the next generation Fusion apps and all that. For me, it was quite easy for us to, devise a technology solution which was already available in US and other developed and try to fit in Indian context. But India in general is very different, especially
Absolutely.
from a rural perspective. The people who are using the technology, the internet, there is a sporadic internet connectivity in the last mile. So
language is a problem.
Yes. So we had developed the technology bottom up, meaning that I literally was spending time in the rural areas trying to understand the mindsets of the people, and then we developed the solution. So our solution is working at a very low internet bandwidth space, and even a chai wala would be able to use our tablets with this thing. So that is so easy in just 2 weeks of training.
You've developed this technology from scratch. And iCure is not just using it for itself, but sharing it with a lot of other organizations. Tell me about how this technology works and what are the features and what it took to develop it.
This product is called WIMS, Wireless Health Incident Monitoring System. Mm-hmm. And it captures two aspects. One is on the clinical aspects, like presence, registration. There are clinical aspects like prescriptions, medicines, various vital stats, allergies. So the entire details can be shared. And in addition to that, if the patient is referred, let's say from a rural health center to a hospital, even those transactions are being captured. In addition to that, on the non-clinical side, for instance, if some organization is using, like in case of iCure, we would be able to record pharmacy, billing, inventory, data analytics, like in each of my centers, what is my footfall like, what is my medicine consumption like, what is my cost like, what is my revenue like. So all these things can be shared. And we have also worked on the data analytics part. if you try to do any kind of data analytics, which is is huge challenge for any government, any research organizations. If I want to understand how many people in a particular region is suffering from this, we don't have. I mean, we might have a very historical data, but in our case we would be able to pinpoint any information.
And that data is very important.
Very important
from a developmental point of view.
From a research point of view. That's why many research organizations are looking forward to partner with us, to provide our technology and using this data to, program their missions in a much better way.
আমার নাম শ্রী হরেন মাহাতো, গ্রামের নাম বোড়া। আমরা এসেছি ভেটিয়াতে হাইকোর্ট কোম্পানির চিকিৎসার জন্য। তো এখানে ওষুধপত্র ভালো দেয়, ভালো ভালো বড় বড় ডাক্তারবাবুরা এসেছে। হসপিটাল অনেক দূরে, আমার যাতায়াতের ব্যবস্থা খুব খারাপ। তো এই কোম্পানি যদি আমাদের গ্রামে এসে ওষুধ দেয় সবাইকে, ভালো হয়। আরও বড় বড় ডাক্তারবাবুরা এসে চিকিৎসা যদি ভালো সুযোগ সুবিধা আমাদের করে দেয়, তাতে গ্রামের লোকে সবাইয়ের ভালো হয়।
iCure currently provides healthcare in 300 villages in 2 districts in West Bengal. It works closely with the government and with non-profit and CSR programs to expand its reach and grow its facilities. Today, iCure also has rural health centers in some parts of Orissa. Sujay Santra tells us about how these health centers work.
Typically, these rural health centers, they comprise of the doctors, medicines, basic tests like BP, ECG and sugar test has been done. And with our software, the entire, the medical records is captured. Especially in the rural areas, we have seen the patients, they forget their prescriptions, and the doctors will have a tough time to diagnose and find out that what kind of medicine.
So if everything's electronic, then
yes,
it's easy to
yes.
pull that off and refer back.
Yeah. The whole concept of our setting up of this rural health centers is the patients would be able to get a one window service. Like once they come within the clinic, they are able to get a doctor consultation, physical doctor consultation, medicines at just ₹90, which we are charging for 3 to 5 days, as against they have to pay 300 to 400 rupees for the same set of services elsewhere. In addition to that, in case the patient needs any, secondary or the tertiary care, we have connectivity with several hospitals in West Bengal and in Mumbai, also in AIIMS, New Delhi.
Okay. So the specialists are able to plug in and offer
yes.
support.
Yeah.
I guess the challenge, particularly in rural India, is that you're not going to necessarily go back to the same doctor all the time. And therefore, to have an integrated solution that helps you maintain records and helps the doctors refer back to the history of the patient, each of the patient's medical records, is important.
Yes.
What is your dream with this in the long term?
We are looking forward to set up close to 300 centers by end of 2016 and treat more than 1 million patients. We believe that iCure is a platform that can help us connect several low-cost, innovative devices and solutions that can cater to these rural areas. And we are getting several requests from the entire pan-India for reaching out and providing the technology solutions. So recently we have tied up with the Dima Hasao district in Assam, which is the only hill district. So I'll talk a brief about this Dima Hasao district. It's during torrential rains, like 4 to 5 months of rain, there are landslides and the patients, they get completely cut off. So using these tablets, these health workers would be able to reach out to these patients and, capture the various clinical information and send it to the doctors for any kind of help.
And provide them support.
Yes, help and support. Yeah. And recently I was as part of the East Africa Summit by Sankalp, wherein the East African community also has same kind of problems, wherein we would want to provide our technology for those countries as well.
That's fantastic. So you developed the technology first.
Yes.
Then you looked at what was needed on ground, so you put in your own healthcare centers.
Yes.
And the next thing is you're collaborating with other organizations, so your technology can benefit millions of people or billions of people everywhere in the remotest parts of the lands.
Yes.
iCure's founder, Sujay Santra, is a first-time entrepreneur. He quit a well-paying job with Oracle to start a business that cares for those unable to access quality healthcare. Here's Sujay sharing about the journey of building a profitable business. Sujay, You gave up a job in Oracle, a well-paying job in Oracle, to go create technology that can connect the remotest person in India with a good doctor. What motivated you to do this?
When I was still working in Oracle and I was still figuring it out that whether I should jump the boat or not, during that time I used to travel a lot to the villages trying to understand the challenges on ground. And during one of my interaction, I was speaking to a old lady and I was sharing my thoughts that would you like something of this sort, and I could see the tears in her eyes that okay, if you can do this it would be great. And today in this 4 years of journey, when I go back and look back to the villages and I see that patients are happy, I see the smile in their faces, the passion, the warmth, the love that they share, I mean, there is no match to that in any way. So that passion and drive is definitely, keeping us to move forward, keeping iCure to move forward.
That's fantastic. And have you been able to drive down costs to make this financially profitable, viable, sustainable?
Yes, so right now we have 22 rural health centers of our own, out of which around 6 of them have already reached break-even. Because what we believe is healthcare is a subject that has to be on a sustainable fashion, because if it is completely depend on a donation basis, tomorrow if your donation stops, you would be stopping the basic services. So that is in a way causing more harm to the community.
Yeah.
So we have tried the model in such a way, it's a volume based model, and patients are able to afford 90 rupees for a doctor consultation and medicine.
Sujay, thank you so much for your time.
Thank you.
It's been fantastic hearing about what you're trying to achieve at iCure. It's an absolutely brilliant idea, and I wish you all the best.
Thank you. My pleasure for inviting us on the show.
Thank you. Yeah. Well, I hope you enjoyed the episode. Check out iCure's work at icure.in. Leave us a comment on what you thought about this episode. Do share and do subscribe. Thank you. If you enjoyed that conversation, here's more.